lecture is 755 nanometer picosecond laser. It's PicoAlex. Has become a hot issue nowadays. 19 years old female. This before and after. Further, after 2 sessions of picosecond laser PicoAlex, would you like to have a before-after photo like this? Despite trying main treatments such as Lumpur 755 laser and IPL, they never result in such a clean output. With Pico 755 Pico laser, it's possible. Let's talk about 755 picosecond laser. There are 2 types of wavelengths for Pico laser. OneTech is the only laser company in the world can produce these 2 types picosecond laser. Recently, OneTech launched the world's first 250 picosecond laser, Majesty. Today's my lecture is first the significance of 755 picosecond wavelengths. Next is clinical cases. Look at the characteristic of 755 nanometer wavelengths. It has excellent malign absorption and penetration depth. So 755 wavelengths is the most ideal wavelength for pigment treatment. PicoSure was the world's first 755 nanometer picosecond laser. PicoAlex is the world's second 755 picosecond laser. In 2022, Cynosure released the PicoSure Pro with increased energy, 300 millijoule. OneTech also achieved 300 millijoule. In 2023, I checked the energy. Increasing power is have 2 advantages. It's not working. Hello? Big spot size, fast result, and deep penetration. I'm sorry. Right after only 755 picosecond laser, the reaction right after. So, the reaction between 532 nanometer wavelengths and pigment region is too strong and bulky, while 1064 nanometer wavelengths is too weak. After all, I'm not satisfied with this pigment treatment, so I believe the wavelengths that pierce this gap is 755 picosecond laser. Next, I show you clinical cases. First is melasma. It's melasma. My age, I'm 54 years old. I opened my clinic 21 years ago. In 2005, there was no concept of laser toning. I used IPL and peeling treatment for melasma. 3 days later, the same patient, she has been treated several times before. If it gets worse, she come back to my hospital for treatment. After 3 times of 755 pico toning, there is a noticeable improvement. Personally, I think 755 pico laser shows the fastest result in treating melasma. It's 2019 and 2022, 2023. Same patient. Twenty 2024. 2025. I have been treating her for about 20 years. She is now 52 years old. She is currently undergoing treatment. Melasma is not curative. It's care disease. It's another person. She had only one session of 755 Pico toning. It works fast for melasma. Combination treatment, you can see 755 nanometer Pico toning and long pulse genesis, TNA is tranexamic acid medication. It's combination treatment. You can see performance later. UV image, pigmentation treatment with PicoAlex. 1 year later. It's 5 years later. So the result is awesome. And next, another patient is before using Pico laser, I treat melasma with nanosecond laser. I have been using 1064 Pico toning for melasma treatments since 2016. Since 2019, I'm using the 755 Pico toning for melasma treatment. 2022, 2021, 2022. It's 2025. I've been treating her for about 15 years. She's currently undergoing treatment. Melasma is not curative, a controlled disease. Maybe you know that. And next is light simple pigmentation. This is a light pigmentation. In such a case, treatment is not easy. Even with long pulse laser with increased energy, the response can vary. This video shows treatment of this light pigmentation. After steroid ointment applied for 3 days and regenerative treatment applied, you can see 1 hour later, right after 1 hour later. This is a paper on the threshold for the melasma disruption using 755 Pico laser. It indicates that 2.49 joule is the minimum threshold energy required to break the melasma. In other words, 2.49 joule may be sufficient to cause change in melasma. It's very important. So, I believe the most ideal parameter for the 755 Pico laser for pigmentation treatment are 3 millimeter, 2.49 joule is very important. So I use this parameter. Freckle, before, right after, 2 weeks later, using 3 millimeter, 2.4 joule. Means treatment very easy. And right after, 2 weeks later. And right after, next day, 6 weeks later. Freckle. Sometimes Freckle does not respond to any treatment. Long pulse laser, IPL, great response to 755 Pico laser. And 6 months later, it's the same case. 755 picosecond laser is the choice of treatment, the failing treatment, pigment treatment case. Next. This is a follow after 1 session of Pico laser for pigment treatment and 2 sessions of Pico toning for dark skin treatment. Before, after. 1 session for pigmented treatment, 3 mm, 2.40, and Pico toning for dark skin treatment. It's very awesome. Next. Next is rantigine seborrheic keratosis. In the case of thick rantigine, if it's less effective in primary treatment, increasing energy and treating strongly. After that, aggressive dressing therapy is performed 2 weeks. First, use the CO2 fraction laser, and then use the 755 Pico laser strongly. Treated laser is irradiated at 30% overlap. Right after, I put on cooling and steroid ointment. Maintain ODT is occlusive direct therapy for 2 weeks. It is video removing the hydrocolor sheet in 2 weeks. Right after, 6 weeks later. After 2 weeks, the pigment crust on hydrochloride sheet. Same treatment. Next. This is a video treating another rantigine using the CO2 fractional laser, and then use the PicoAlex 2 mm and 7 joule. The laser is irradiated at 30% overlap. Right after, I put on the cooling, post-cooling, and steroid ointment applied. After that, ODT, occlusive dress therapy, maintain ODT for 2 weeks. And 3 weeks later, 2 months later, no PIH. Next. Two months point, no PIH. You can see UV imaging. Yeah. Next. It is well documented in several studies. The rantigines have a thicker epidermis and more developed blood vessels. These blood vessels highly associated with PIH. So, for prevention for PIH, post-cooling and steroid oint and occlusive therapy 2 weeks is very important. Next. We have learned the vascularity in rantigine is cause an important factor in developing PIH. Therefore, selecting 755 nanometer wavelengths is optimal choice, avoiding PIH. Next. Next. In this study, 755 pico laser is effective for treating refractory melasma. It's a case in which several hospitals failed to treat melasma. After 2 sessions, after right side, next, after 3 sessions, 1 year later, you can see? Okay. 2 years later, it's another patient. It's a very complicated case. The patient with melasma, pigmentation, and dark skin that seem prone to complication. What would be the best treatment? What should I do? It's very hard. And this paper, using the 755 pico laser with high energy for 4,000 shots, showed improvement in oral pigmentation. For this patient, I increased the energy level and number of shots per sessions compared to standard toning. Apply steroid. Next. As performance later. 755 pico toning. Genesis. Next. Next. Just one. It's ABNOM. The effect is big after 3 sessions of 10-6 per pico laser treatment. 755 pico laser has great improvement. Next. As 18 years old female, we can see improvement after 2 sessions. She has a capillary spot. Next. Right side. Next. UV image. Next. Next, PIH. Traumatic PIH. 755 pico toning after 3 sessions. Next. This slide side effect born from the 1450 nanometer diode laser. Next. So after 4 sessions. Next. I visited my laser room and I considered which laser to purchase if I opened a new clinic. My choice would be first is ABNOM laser, next is long pulse laser, and 1450 nanometer diode laser is necessary. Finally, second laser is 755 picosecond laser. Next. We held conference in Japan on June in 2025. Next. Next. Next is Hanoi in July. Next. Next. In China on August. Next. 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 We held the conference in all of Asia. Next. Next. In Bangkok in August. Next. 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 In Jakarta in November. Next. Next. In October 2025. Next. Next. And April 2026. Next. I look forward to your active participation and support. Thank you very much.